annual Critical Incident Stress Management Conference. Even more people here this year. The purpose is for us to come together, share our stories and actually draw upon each other to how we can look after each other as well. And the skills and the knowledge, it's just inspirational for me to actually be here on a day like today. So we've got many people here from across the combined healthcare, University Hospital in North Midlands, Shrewsbury and Telford hospitals are actually here as well. We've got representation from the fire service, different fire services, because they're introducing something in the way they're adapting, the way they look after staff. So it's really inspiring to come together and keep the cogs of critical incident stress management rolling.
So last year we attended the CISM conference, and I felt as though as P&As we needed to come back this year and talk about our journey so far at combined healthcare. I've been a CISM practitioner for as long as I can remember, but more recently trained as a professional nurse advocate, and we wanted to come back today to identify what the links are between professional nurse advocate, restorative clinical supervision and CISM debriefs.
So I guess what we wanted to think about and how we wanted to link it is what we recognise as P&As across the, in our sessions is the impact of repeated stress and the impact of accumulative trauma, and how we link what we do as professional nurse advocates and supporting the workforce to actually that debrief model as well.
So what I wanted to do was to share the role of the P&A and about my journey with supporting a ward that I'm doing at the moment, how we started off the journey and to the positives that we've got now, at the journey now, and to share that with people as well.
So I did a session on the support for staff in A&E, and as well speaking about my personal experience with loss and how that's affected my nursing practice and moving forward looking after my colleagues.
We talked about initially the review that we'd done into post-critical incident support for our fire service, which is Cambridgeshire Fire and Rescue. We interviewed a lot of different people across the service, but primarily firefighters and control operators, because what we had wasn't really working. So they commissioned a review, which two of us took up, which is Watch Commander George and myself. And now, from the review, I just talked everybody through the journey really that we come on. It took 2 years ago we started the review.
We talked about how we would practically implement it for operational crews and for control staff as well, what that would look like and how we plan to actually physically deliver those sessions. Also, a few of the different services have given us a bit of a heads up and a bit of to heed a warning about taking care of the diffusers and the debriefers.
Yeah.
And we're a fairly close team and a relatively smaller team, but it's come from a few different services that have said to make sure we do care for the diffusers and the debriefers. We're new and enthusiastic and excited about it. Some of the other services have been doing it for a very long time, and they've obviously experienced the effects that it has on those as well. So I'm going to heed that warning and make sure we take care of each other.
CISM to us is we deal with a lot of sort of trauma in our line of work, and people have experienced trauma, so kind of that debrief is really important. And it's been really good coming today and hearing how things are moving forward with CISM and how other organisations are taking on the practice and implementing it in their line of work. Yeah, I think that's it really.
And for me, I think hearing people talk about the peer support and having that reinforced through the day has been really good. When we've gone out and experienced trauma in our workplace, we go back to the office and look at each other for peer support and people within the team to get that peer support to help us through it.
It's been a fantastic day here at the Critical Incident Stress Management Annual Conference. We've had a wonderful day meeting with colleagues and peers who are trained in critical incident stress management, and heard from lots of other different sectors as well about how they're embracing this as a model to improve the health and well-being of the workforce. I think it's fair to say, from an NHS perspective, we've got our work cut out. We need to do more to support our staff to stay well and to look after them as part of they undertaking their roles, but we very much hope that CISM is part of our embedded practice to supporting that health and wellbeing approach.
Today has been completely inspiring. I've learned things where you sow a seed, it gets taken to the various areas where people work, they plant it, they nurture it, they grow. I feel like I'm coming away with a huge to-do list, which is always good for me to think, we can do this, we can do that. So to me, energy packing, amazing.